What is audiometry and how does it work? Imagine being able to listen to the world around you and know exactly how well your ears are functioning. That's what audiometry helps us do. It is a clinical test used to measure how well someone can hear sounds of different pitches and loudness levels. This test looks at how the entire hearing system works, from the outer ear to the brain pathways that process sound. The main goal is to find out if there is hearing loss, what kind it might be, and how severe it is. This information helps doctors decide the best way to treat or manage hearing issues. The process uses a special device called an audiometer. This electronic instrument produces pure tones, simple sounds at specific pitches and loudness levels. During testing, the audiometer is connected to headphones placed over the ears or a bone vibrator that touches behind the ear. The audiologist controls the sounds and asks the person to respond when they hear a tone. This way, they can find the quietest sound the person can detect at each pitch, which is called the hearing threshold. There are different types of tests in audiometry. The most common is pure tone audiometry. Here, single-frequency sounds are played through headphones or a bone vibrator. The person indicates when they hear the sound, helping the audiologist map out their hearing ability across different pitches. Speech audiometry is another test, where the person listens to and repeats words to see how well they understand speech. Tympanometry, or impedance audiometry, measures how well the middle ear is working by checking the movement of the eardrum and ear pressure. For more detailed information, especially when behavioral responses are difficult, there is the auditory brainstem response test. This measures how sound signals travel from the inner ear through the brainstem, providing an objective assessment of hearing. In audiometry, two main pathways are tested: air conduction and bone conduction. Air conduction testing involves sounds traveling through the ear canal, eardrum, and middle ear before reaching the inner ear. It assesses the entire hearing pathway. Bone conduction bypasses the outer and middle ear by sending vibrations directly to the cochlea, the inner ear. This helps determine if hearing loss is due to issues in the outer or middle ear, known as conductive hearing loss, or in the inner ear or nerve pathways, called sensorineural hearing loss. The results of these tests are plotted on an audiogram, a graph that shows how sensitive a person is to different pitches and loudness levels. The audiogram helps identify the type of hearing loss, whether it is mild, moderate, severe, or profound, and the pattern of hearing loss across frequencies. This detailed profile guides healthcare providers in recommending the best treatment options, such as hearing aids or medical interventions. Audiometry is a vital tool in hearing healthcare. It is used not only to diagnose hearing loss but also to monitor hearing over time, assess the impact of noise exposure or medications that might affect hearing, and evaluate the success of treatments. The tests are performed by trained audiologists or healthcare professionals following standardized procedures to ensure accurate results. Remember, if you suspect hearing issues, consulting a healthcare professional is always the best step. Audiometry provides a safe, non-invasive way to understand your hearing health and helps ensure you can enjoy the sounds of life to the fullest.